Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your life. Today, let's talk about gastroesophageal reflux disease, or GERD, and why small actions can make a real difference. GERD happens when stomach contents move backward into the esophagus. The esophagus is the tube that carries food from your mouth to your stomach. The stomach is built to handle acid. The esophagus is not. So when acid, digestive enzymes, or food repeatedly wash upward, you may feel burning in the chest, sour taste in the mouth, burping, throat irritation, cough, hoarseness, nausea, or a feeling that food is coming back up. Now ask yourself this: why can something as simple as meal size, timing, posture, or sleep position matter so much? Because GERD is not only about acid strength, it is also about pressure, anatomy, gravity, timing, and sensitivity. Look at the lower esophageal sphincter. This is the muscular valve between the esophagus and the stomach. Its job is to open when you swallow and close afterward. If that valve relaxes at the wrong time, or if pressure inside the stomach becomes too high, reflux becomes more likely. So the small actions we discussed today are not random tips. They are ways to reduce pressure, improve stomach emptying, use gravity, and reduce irritation. Start with the first small action: reduce the size of your meals. Do this before you start cutting out every food you enjoy. Why? A large meal stretches the stomach. A stretched stomach creates more upward pressure. More pressure means more force pushing against that valve. If the valve opens, stomach contents can move upward. How do you apply this? Keep your meals smaller and slower. Stop eating when you are satisfied, not when you are completely full. Use a smaller plate. Pause halfway through the meal. Ask yourself, am I still hungry, or am I just finishing because food is there? This matters because many people with reflux do worse after a large dinner, especially a heavy evening meal. The second action is timing. Avoid lying down soon after eating. This is one of the most practical steps. Why? When you stand or sit upright, gravity helps keep food and acid in the stomach. When you lie flat, gravity is removed from the equation. If your stomach is still full, reflux becomes easier. Do this. Give yourself at least 2 to 3 hours between your last meal and bedtime. If your symptoms are strong at night, aim closer to 3 hours. Pay attention to snacks too. A bedtime snack can trigger reflux just like a meal can. Ask yourself, am I eating because I am hungry, or because it is a habit before sleep? If it is a habit, change the routine. Try water, a short walk, brushing your teeth earlier, or moving your evening meal slightly later but still leaving enough time before bed. The third action is changing your sleep setup. If nighttime reflux is your main issue, elevate the head of your bed. Do not just stack pillows under your head. That can bend your neck and abdomen in a way that may increase pressure. Instead, raise the upper body. Use a wedge pillow or elevate the head of the bed by several inches if it is safe and stable. Why does this help? Again, gravity. When your upper body is higher than your stomach, it becomes harder for stomach contents to travel upward. This does not work for everyone, but studies and guidelines support it, especially for nighttime symptoms. If you wake up coughing, choking, tasting acid, or needing water at night, look at your sleep position. Also pay attention to which side you sleep on. For many people, lying on the left side may reduce reflux compared with lying on the right side. Why? The stomach sits in a way that can make reflux less likely on the left side. This is a small change, but for some patients it is meaningful. Try it for a week. Track symptoms. Do not judge it after one night. The fourth action is weight management when weight is contributing. Be careful here. This is not about blame. This is about abdominal pressure. Extra weight around the abdomen can increase pressure on the stomach and make reflux more likely. Even modest weight loss may improve symptoms in people who are overweight. How do you approach it? Do not start with extreme restriction. Start with meal timing, smaller portions, less late night eating, and more walking. These same actions help reflux and support weight control. Do this. Walk for 10 to 15 minutes after meals if you can. Keep it gentle. Do not do intense bending, heavy lifting, or abdominal exercises right after eating. Why? Light movement can support digestion, but straining or bending can push pressure upward. If you notice reflux when tying shoes, doing sit-ups, gardening, or lifting weights after meals, change the timing. The fifth action is identifying your personal triggers. Many people are told, avoid coffee, chocolate, peppermint, spicy food, citrus, tomato, fried food, alcohol, carbonated drinks. But here is the important point. Not every trigger affects every person. Some foods relax the lower esophageal sphincter in some people. Some foods irritate an already sensitive esophagus. Some simply slow stomach emptying because they are high in fat. So do not create an unnecessarily strict diet overnight. Do this instead. Keep a 2-week reflux diary. Write down what you ate, when you ate, meal size, body position afterward, stress level, and symptoms. Look for patterns. Ask yourself, is it the tomato sauce or is it the large late dinner? Is it coffee itself or coffee on an empty stomach? Is it spicy food or eating it at 10 p.m. and lying down at 11? This is how you make small actions medically thoughtful. You separate food triggers from behavior triggers. If coffee triggers you, reduce the amount, switch timing, avoid it late in the day, or try a lower acid option. If fried food triggers you, reduce portion size and avoid it near bedtime. If carbonated drinks bring up burping and acid, cut them down and observe. Pay attention to alcohol because it can relax the valve and worsen nighttime reflux. If you smoke or vape nicotine, seek help to stop. Nicotine can affect that valve and also harms the lungs, heart, blood vessels, and cancer risk. The sixth action is clothing and abdominal pressure. Look at your waistband. Tight belts, tight shapewear, or tight pants can increase pressure after meals. This sounds minor, but in the emergency department, I often ask patients about timing, meals, and pressure because the body is mechanical. If your symptoms happen after lunch at work, ask yourself, am I sitting compressed for hours? Loosen the waistband, sit upright, stand for a few minutes, avoid slumping after meals. These small choices can reduce the upward pressure that fuels reflux. The seventh action is medication awareness. Many people treat GERD with antacids, H2 blockers, or proton pump inhibitors. These can be helpful, and sometimes they are exactly what is needed, but use them wisely. If you need over-the-counter medicine frequently, tell your clinician. If you are already taking prescription medications, ask about interactions. Some medicines can worsen reflux or irritate the esophagus, including certain pain relievers, some blood pressure medicines, some asthma medicines, iron tablets, potassium tablets, bisphosphonates for bone health, and others. Do this. Take pills with a full glass of water unless your doctor told you otherwise. Do not lie down immediately after taking medication. Ask your pharmacist, can any of my medicines worsen reflux or irritate my esophagus? This is especially important if you are pregnant, have kidney disease, liver disease, heart disease, osteoporosis, anemia, are on blood thinners, or take several medications. Now let's talk about pregnancy. Reflux is common during pregnancy because hormones can relax smooth muscle and the growing uterus can increase abdominal pressure. Small meals, avoiding late eating, elevating the upper body, and avoiding known triggers may help. But do not start medications or herbal remedies without speaking with your obstetric clinician. Some products are not appropriate during pregnancy, and natural does not always mean safe. Pay attention to red flags. GERD symptoms can overlap with more serious conditions. Get urgent medical help if you have chest pain with shortness of breath, sweating, fainting, pain going to the arm, jaw, back, or neck, or if the pain feels like pressure or heaviness. Do not assume it is reflux, especially if you have risk factors for heart disease. Schedule medical evaluation if you have trouble swallowing, pain with swallowing, vomiting blood, black stools, unexplained weight loss, persistent vomiting, anemia, choking episodes at night, symptoms that are getting worse, or symptoms that continue despite appropriate treatment. Also get evaluated if you need reflux medicine for many weeks or symptoms keep coming back. Sometimes we need to consider esophagitis, strictures, Barrett's esophagus, ulcers, gallbladder disease, heart disease, or other causes. Now, why are small actions effective? Because GERD often builds from repeated small exposures. One large meal may not be the whole story. It may be the large meal, then lying down, then tight clothing, then alcohol, then a late snack, then sleeping flat. Each one adds a little pressure or removes a layer of protection. So the answer is not always one dramatic change. The answer may be stacking several simple actions in the right direction. How should you start? Pick 3 actions for the next 7 days. Make dinner smaller. Stop food 3 hours before bed. Elevate your upper body at night. Track symptoms. If you improve, keep going. If you do not improve, adjust. Add a trigger diary. Look at caffeine, alcohol, fried foods, peppermint, chocolate, tomato, citrus, and carbonation. Do not guess forever. Observe, test, and personalize. And remember, small does not mean weak. Small means repeatable. A repeatable action done every day can reduce reflux episodes more than a perfect plan that lasts 2 days. Start with the mechanics. Less stomach stretching, less late night fullness, better gravity, less abdominal pressure, and smarter trigger awareness. GERD can be frustrating, but you are not powerless. Use these steps as a foundation and involve your healthcare professional when symptoms are persistent, severe, or complicated. The goal is not to pretend every case is simple. The goal is to take control of the parts you can control while getting proper care when your body is asking for more help. Take care of your meals, your timing, your posture, and your sleep setup. Pay attention to your patterns, ask better questions, and if symptoms do not settle, get evaluated. Thank you for spending this time with me in Doctor's Corner. Stay safe, stay observant, and I'll see you in the next topic.